So, moving on to our next talk, which is maximizing the fellowship outcomes and what to really expect from phaco fellowships by Dr. Reshmi S, who is a consultant phaco surgeon at Eye Foundation, Calicut.
Good morning, all of you. As Dr. Ann has already described how to choose a right phaco fellowship, I will be talking about how to maximize the outcome from your phaco fellowship. So, whether you select a short-term fellowship or a long-term fellowship, it's going to be a tough time. So, you have to provide your maximum dedication and hard work so that you can overcome the hurdles easily. There is a learning curve for all these procedures. Some surgeons may not be able to overcome the initial frustration barrier and they become dropout. Some people will overcome this frustration barrier. They learn the surgical steps to become a competent surgeon, but they keep on doing what they learned during the residency period. They don't go for experiments and they don't enjoy tough cases. There is a third set of surgeons who will overcome this passion barrier. They find enjoyment in doing tough cases and they learn from each and every case they do. They become the expert surgeons. So what we are going to discuss here is how to learn during the fellowship period, how to maintain the logbook, what about wet lab training and AA based learning, how to handle complications, what after fellowship, what are the qualities to gain, and few tips. So how to learn during the training period. In the initial period of your training, choose only the right case. Perfect each step properly so that you can move on to the next step with confidence. Discuss your problems with your colleagues. They may also face the same issues and think and discuss how they overcome their problems. Learn to stay calm during complications and learn to break the bad news. The slogan for the fellowship period is observe, observe, observe and learn. Record and watch your own surgeries as far as possible and you can be your best teacher. During the training period, gain a good idea of phaco-dynamics, phaco-fluidics, know your phaco machine and the microscope settings. You should get good control of your hand movements, right and left, perfect your wound architecture, identify and manage complications. It is always better to have complications in your training period than to have them during the independent practice. Whenever you have a problem, ask for help or convert to SICS. Don't blame your ego. It is always better to maintain a logbook for your cases. In that, you can record the preoperative findings, intraoperative steps and some problems which you had, and you can also note down the tips which you can take down to decrease the problems in the next cases. Wet lab is a very essential part of any training program. Wet lab helps us to learn the surgical anatomy of the eye, practice the surgical steps properly, learn the intraoperative complications and their management. It helps us to handle the surgical instruments, develop hand-eye coordination and practice steps. In the gut eye, we can learn the sclerocorneal tunnel, capsular access and hydrodissection. The polyurethane foam sheet that comes with the suture material can be used to practice suturing as well as sclerocorneal tunnel. The polythene film that comes with the IOL packaging can be used to learn capsular access also. Nowadays, we have these AI-based learning platforms also. One is the Alcon Experience Academy and the other one is the Size Surgery Optimizer. These are mobile applications which you can download from the Android or the App Store. With these applications, we can view the surgical videos of eminent surgeons, even step-by-step videos they are providing, and we can learn from that. Complication handling is a very essential part of the fellowship program. Two things we have to take care. One is the intraoperative decision making and the second part is handling of the patient. Intraoperative decision making in crisis situation is very important. We should have a game plan ready for each and every complication like PCR and nucleus drop. The second point is dealing with the patient. We should have ready-made phrases with us. Don't be clumsy while communicating with the patient and they may think that we are not confident. We can say that the cataract couldn't be removed as it was not accessible or the membrane was not strong enough to hold IOL, etc. Always give further management options like the VR surgery and have a definitive plan for such patients. Near fellowship period, sometimes you may have this burnout syndrome. It is characterized by emotional exhaustion, depersonalization and a sense of low personal accomplishment. It is seen in 60% of the fellows and trainees. If you face this at any point of time, don't be reluctant to ask for help. You will have complication, you will get scolding, you will get punishment, everything can happen. But never give up. You may feel worthless, but never think that I can't make it. Never compare yourself with others because everyone has different potentials. Compare yourself with whom you were yesterday and try to improve each day. Become independent, self-motivated and self-directed. Believe in yourself and you are halfway there. So what after fellowship? You may go for independent practice or a group practice. Whatever you do, select good patients and good cases initially, spend enough chair time with them, slowly take up challenging cases and thus develop your career. There is a concept that the surgeon's hands are the blessed hands. That's not true. Surgery is done with the mind and not with the hand. Great surgeons must have equipped his mind to anticipate, plan, analyze and implement appropriate thing at the right time. So, the qualities to be gained during the fellowship period is a good surgical judgment, that is very important. Good dexterity is needed, intelligence, knowledge, creativity, courage, perseverance, and most importantly, mind training. Surgeons are not born great, they are just made great. So, the tips for improvement include set appropriate goals during the training period, create a timeline and evaluate your progress periodically, develop essential skills, do the pre work before each day training session so that you can improve daily, build strong relationship with other fellows, develop critical thinking, read more, attend conferences, and identify areas of improvement. So, above all, attitude is everything and never consider yourself as an expert. Thank you.
Thank you, Dr. Reshmi, for those motivating